This all morning. We're talking about the MERS virus. It's killed people overseas, and now for the first time in the United States, it is right here in Indiana. Hoosier scientists have been at the forefront of the effort to keep the virus from spreading, and now we are joined by Andy Messakar, Andy, a PhD at the Purdue Center for Cancer Research. Now tell me, what turned you on to this research, and how might it help folks now that it's a reality here in the Hoosier State?
Well, we started working on the SARS virus about 10 years ago after that outbreak to develop small molecule therapeutics to treat SARS infections should they ever come back. The research that we've been pioneering since that time with collaborators at Purdue, Aaron Ghosh, who has developed a drug for HIV, which is on the market, as protease inhibitors. We've been able to take that research that we've been doing in the lab with our graduate students and postdocs and translate that right away into trying to develop therapeutics against the MERS virus.
Gotcha. I want to explain to viewers what we have on display here right in front of us. What are we looking
at?
Absolutely.
So this is a protease enzyme from the MERS virus. It'd be like HIV protease that we have drugs out. And it's an atomic structure that we solved at Purdue University. And in the front, right here, is the drug molecule. This is like a cartoon ribbon description of a representation of the enzyme, and this is what the small molecule drug would be.
Gotcha.
So it's like a hand in a glove fitting together that would knock out that enzyme, which is essential for MERS virus replication, which would essentially eliminate MERS.
How close are we to this being a reality? Because as I understand it, the death rate from the MERS virus is something like 30%.
Right now, it's dropping now. I think we have about 295 laboratory confirmed cases on the planet right now, and about 95 deaths have occurred from that. But as the virus has spread, the secondary cases we're finding that they're not as lethal. So I think you'll continue to see that number drop as we understand the virus, because that's what we observed with the SARS virus.
What's it like to be at the forefront of this? Just on a personal level here, you're doing research that really matters, and then of all places to have this first case, it's right in your backyard.
I mean, that's, we always work behind the scenes, and this is sort of validation of what we're doing because we want to be prepared for outbreaks such as this. And my lab is excited. My students, Sakshi and Sarah, and the other graduate students in Aaron Ghosh's lab, Heather, are actually we're working late last night to continue because of what had happened in Indiana. It's not something, we kind of felt it was going to come to the United States. But to have it happen so close to home was surprising to us.
Last thing really quickly, we have about 20 seconds left, but I want viewers to walk away with an understanding of what they should do if they suspect that they're coming down with any of the symptoms.
Yeah, it's nothing to be alarmed about. I mean, you have to have contact with somebody that's traveled in the Middle East, and I think, that's going to be very rare. We're all going to get, some type of cold or flu. And, let people know coronaviruses have been around. We've identified these in the 60s. You and I have probably been infected by a coronavirus, NL63, OC43. In fact, your cats, there's a cat coronavirus that kills cats. So this is not a rare event. We are surrounded by coronaviruses all the time.
You've equally made me more comforted and more paranoid in the same sentence, Andy. No, mostly more comforted. I really appreciate this conversation. Thank you so much for being with us. And we'll post more information and this interview if you need to watch it again on fox59.com. So stay with us and connected for that. In the meantime, we're going to turn the mood around a little bit at 9:26. We're enjoying spring with some new cocktails. Yes, that's what